We have finally reached the very last topic under asphyxia. And even though it is the last topic, it is probably one of the most important from both entrance examination and university paper point of view. And that topic is drowning. So I want you to listen to me very clearly because I'm going to make the concept behind drowning crystal clear. Starting off with the definition of drowning as always. Definition. Drowning, just like hanging, strangulation and suffocation, leads to mechanical asphyxia. But here, asphyxia is not due to neck compression. It is due to the submersion of body in a liquid medium. Now, this submersion can either be complete or partial. That is, your body does not have to be completely inside the liquid medium to be drowning. Even if just your face is inside the liquid medium, just your nose and mouth is inside the liquid medium, that is enough to kill you by drowning. Mechanism behind drowning. So let's say I'm walking beside a deep lake and I accidentally fall in that deep lake. And yes, most of the cases of drowning are indeed accidental. Once I fall in the lake, what am I going to do? I'm obviously going to hold my breath in order to prevent the entry of water inside my lungs. But just for how long am I going to hold my breath? Eventually, my body will ask for oxygen. Eventually, oxygen will run out. My body will become hungry for oxygen, referred to as air hunger. Once there is air hunger, my body will involuntarily inspire. Involuntarily inspire. As a result, there is entry of air, but there is also entry of everything around. That is, there is also entry of water. And it is the entry of water that leads to death by various consequences. So the consequences have been broadly classified into two. The first consequence is where as soon as the water enters inside the respiratory tract, it enters the larynx, it irritates the vocal cord, and the vocal cord, it shuts off. This is referred to as vocal cord spasm. As soon as vocal cord spasm takes place, water is unable to enter. Water is unable to enter. So there is no entry of water. Yippee, you are safe, right? No, because along with water, there is also no entry of air. And if there is no entry of air, aeration of blood will not take place. And what do you call when there is defective aeration of blood? You call it asphyxia, and there is death by asphyxia. This right here is referred to as dry drowning. It is referred to as dry drowning, aka atypical drowning. Why is it called dry drowning? Because the water does not enter inside the lungs, so the lungs are relatively dry. So what's happening in short? Water enters inside the respiratory tract, it enters the larynx, it irritates the vocal cord spasm takes place, water is unable to enter, but along with that, air is also unable to enter the lungs, it does not reach the lungs, aeration of blood does not take place, asphyxia happens and you die. Second consequence is when water actually enters inside the lung. Water enters lungs. And when that happens, we refer to drowning in such case as wet drowning. Because here, as the water has entered the lung becomes wet. This is also referred to as typical drowning. Now, the consequence under typical drowning is further divided into two. And this is on the basis of amount of water that enters inside the lungs. What? On the basis of amount of water that enters inside the lung. In first case, comparatively less water enters inside the lung. That is 4 ml per kg of water enters inside the lung. In the second case, comparatively large amount of water enters inside the lung. 16 ml per kg of water enters inside the lung. So when 4 ml per kg of water enters inside the lung, this is what happens. The wall of the alveoli from inside is lined by surfactant. When 4 ml per kg of water enters inside the lung and then inside the alveoli, it washes off the surfactant. It washes away surfactant. Now it is the surfactant that is responsible for maintaining surface tension. So if surfactant is washed away, there is loss of surface tension. And when surface tension is lost, the alveoli collapses. Once alveoli collapses, exchange of gases won't take place and the person dies of asphyxia. Good? Good. This is what most commonly takes place. But sometimes there can be rapid flow of water, of large amount of water inside the lung, and that will lead to consequences as a result of 16 ml per kg of water entering inside the lung. Now even this is of two types, depending on the type of water that enters inside. Again, first you had weight drowning leading to two different consequences on the basis of amount of water that enters inside. For 4 ml per kg of water, we saw the consequence. Now we are looking at 60 ml per kg. Now within 60 ml per kg also, we have two different consequences depending on the type of water that enters. So whether it is fresh water or if it is salt water, that is sea water. You know very well that fresh water is hypotonic and salt water, it contains lots of salt, so it's going to be high in concentration, so it's hypertonic. And from your college days, you must remember this concept that in osmosis, the flow of water always takes place from hypotonic to hypertonic. Remember this, water flows from hypotonic to hypertonic. And if you know this much, just this single line, that water flows from hypotonic to hypertonic, you can interpret the rest of the consequences of these drowning on your own. See, let's compare both. Okay, so in first case, there is entry of fresh water inside the alveoli. This is the alveoli, surrounding which this is the capillary of the alveoli. Here also same thing, alveoli along with the capillary of the alveoli. In first case, there is entry of fresh water. Fresh water is hypotonic, so it moves from inside the alveoli to inside the circulation where the concentration is higher. As a result, there is hemodilution. Blood becomes dilated. Hemodilution. Hemodilution also leads to, since there is addition of water in the blood, the volume of blood increases. So there is hypervolemia. Since there is increased volume of blood, now the heart has to work harder to pump that excess blood. So there is increased workload of heart. Second, what happens? What else is inside the blood? There is plasma and there are your RBCs. The RBCs are also comparatively hypertonic. So the water from the plasma, the extra added water from the plasma also enters inside the concentrated RBCs. As a result, the RBCs, they swell up and they become fat and eventually burst. As the RBC bursts, the potassium from inside the RBC leaks out. And you should know that inside the cell you have more potassium and outside the cell you have more sodium and chloride. So if the cell bursts, all that potassium from inside the cell will leak out, and that leads to hyperkalemia. It is due to the combined effect of hyperkalemia and increased workload of heart that there is death due to ventricular fibrillation. Chill. All right. Second is what happens when salt water enters. When salt water enters, you know that salt water is hypertonic and water moves from hypotonic to hypertonic, that is from plasma inside the alveoli. So the alveoli gets filled with lots of water leading to pulmonary edema. Pulmonary edema leads to respiratory distress, and respiratory distress eventually leads to death by asphyxia. What about inside the circulation? So the circulation has become concentrated because all the water from inside the plasma has gone into the alveoli. So the plasma becomes concentrated. That is hemoconcentration. Due to hemoconcentration, two things happen. Number one, in case of hemodilation, due to addition of water, there was increase in the volume of blood. Here, during hemoconcentration, since there is loss of water from the plasma, there is decrease in the volume of blood, referred to as hypovolemia. And this can lead to death by hypovolemic shock. Second, since there is loss of water from the plasma, the concentration of ions in the plasma increases. And I have already told which ions are present outside the cell in plasma. They are sodium, chloride, magnesium. So as the plasma becomes more concentrated, who else is affected? Obviously the RBC. In this scenario, since the plasma is more concentrated, the water will move out of the RBC. As a result, the RBC shrinks. So the shrinkage of RBC has taken place due to increase in the concentration of these ions, leading to increase in the concentration of plasma. And these are the various consequences that lead to death and drowning. Let's revise them once. Okay, so I'm walking beside a lake and I accidentally fall in the lake. First, I will hold my breath to prevent the entry of water inside my lung. But eventually, I will be hungry for air. So my body will involuntarily inspire, leading to entry of air, but along with that entry of water as well. It is the entry of water that leads to death by various consequences, which is broadly categorized into two. In first consequences, referred to as a dry drowning, there is no entry of water inside the lung. Here simply the vocal cord shuts off. As a result, air is not able to enter in, water is unable to enter in, and the person dies of asphyxia. In second consequence, there is wet drowning where the water actually enters the lung. This is further categorized into two types depending on the volume of water that enters inside the lung. First is when only 4 ml per kg of water enters inside the lung. When 4 ml per kg of water enters inside the lung, then inside the alveoli, it washes away the surfactant of the alveoli. So the alveoli loses its surface tension and the alveoli collapses, leading to death by asphyxia. In second case, when lots of water, large amount of water enters inside the lung, what happens? That depends on the type of water that enters inside. First, we have fresh water, which is hypotonic. Since fresh water is hypotonic, water moves from hypotonic to hypertonic. So water moves from inside the alveoli to inside the circulation. As a result, the circulating blood becomes dilated and the volume also increases due to extra added water. Since there is increased volume of blood, the work of the heart to pump it also increases. There is increased load on heart. Along with that, the extra added water also enters inside the RBC. So the RBC swells up, it bursts, and all that potassium from the RBC leaks out, leading to hyperkalemia. Due to the additive effect of increased workload of heart and hyperkalemia, the person dies of ventricular fibrillation. Second case is where there is entry of salt water, which is hypertonic. Since salt water is hypertonic, water moves from inside the plasma to inside the alveoli. As a result, there is pulmonary edema, respiratory distress, and death by asphyxia. What about inside the circulation? Inside the circulation, since there is loss of water, the plasma becomes concentrated. Along with that, there is also decrease in the volume of blood itself, which can lead to hypovolemic shock. Due to increase in concentration of the plasma, now the water from inside the RBC leaks out. So the RBC shrinks and gets damaged as well. Hopefully you have understood, and not hopefully, I'm pretty confident you have understood the mechanism behind drowning. Now, some very important terminologies. There is death by drowning, where the body has to be submerged in water for it to die, either completely or partially. Now, this is different. Here, in hydrocution or immersion syndrome, there is death due to body fall in water which is cold, and the temperature is 5 degrees Celsius less than the body temperature. So when someone jumps into water, into cold water, and the temperature of that cold water is at least 5 degrees Celsius less than the temperature of that person's body, it can lead to following consequences. So let's say first, the person is emotional, right? Second, the water enters the tympanic membrane, or it enters the larynx, or it enters the pharynx, or in case of duck diving, where you dive head first into the water, or when there is a sudden blow to epigastrium, that is when you dive chest and belly first into the water, there is blow of water, cold water on your epigastrium. In all these consequences, what eventually happens is that eventually they all lead to activation of vagus nerve that leads to vagal inhibition of heart and eventually death. So here death is occurring due to various mechanisms that are as a result of cold water, not the entry of water, but due to the coldness of water. Second is secondary drowning or post-immersion syndrome or near drowning. In these cases, the person dies not because of drowning, but because of complications after the person has been saved from a near drowning situation. And these complications can be hypoxic ischemic encephalopathy, metabolic acidosis, electrolyte imbalance, or aspiration pneumonia. Now we are going to learn about the external and internal autopsy findings in case of drowning. First is froth. The froth is mushroom shaped. It is fine in consistency. It is white in color. It is tenacious or mucoid. It is large in quantity, that is copious, and it is persistent, that is it continues to come out even after wiping, even after you wipe the nose and mouth with a cloth, the froth will still continue to come out of the nose and mouth when you apply little bit of pressure on the chest, because this froth is not coming out of larynx, pharynx, it is coming out of lung itself. So as soon as there is froth inside the lung, it will keep on coming out. So how exactly is froth formed in the lung in case of wet drowning? This is how froth is formed. See, so this is the alveoli, right? In case of wet drowning, there is entry of two things. There is entry of air and there is entry of water. The water, it irritates the mucosal lining. As a result, there is increased secretion of mucus. And inside alveoli, what you already have is surfactant. So now you have all the ingredients for your recipe, but then you can't cook your food. To cook your food, you need to process all these recipes together, and that process is referred to as churning. What is churning? Churning means all these ingredients, they need to be mixed together, and for that to happen, there has to be some struggle in the drowning victim, and that is only present when it is an antemortem drowning. Let me explain. Listen. When you are alive at the time of drowning, you will struggle to come out of that situation. And as you are struggling, there is rapid movement of the body and movement inside the lung as well, or the churning of the lung. As a result, these ingredients, air, water, mucus and surfactant, they get mixed inside the lung, leading to the formation of froth. So, froth coming out of nose and mouth is an important sign of antemortem drowning, a way to differentiate antemortem drowning from postmortem drowning. One concept I want you to remember, your life will be easy. See, whenever there is any sign of struggle, I repeat, sign of struggle, then that will immediately suggest it to be antemortem drowning. For example, in this case, due to struggle, there was froth formation. So froth is a sign of struggle and it indicates antemortem drowning. See, a person can only struggle if he was alive at the time of drowning. If he was dead or unconscious, then he would not struggle, and that would not be referred to as conscious antemortem drowning. Okay, second is cadaveric spasm. Cadaveric spasm is as a result of struggle again, struggle. And whenever there is sign of struggle, it is seen in antemortem drowning. What type of struggle? Trying to hold on to anything, grass, mud, whatever. See, when you are alive at the time of drowning, you try to hold on to anything to come out of that situation. You hold on to grass, you hold on to mud, and after death, you get spasms such that your hand is clenched, your fist is clenched, and you are holding on to that piece of grass and mud. This may not be always present, but if it is present, it is a sign of struggle and it indicates antemortem drowning. Third is goose flesh, goose skin. This is due to contraction of erector pylorem muscle. As the erector pylorem muscle contracts, the hair, like in case of goosebump, it elongates, it straightens up. This is washerwoman hand / feet, seen due to imbibition. Okay, first it is seen in fingertips, then it is seen in palm, then it is seen behind the hand, and then finally in the sole. This is important because this gives you the time since immersion. That is, if you see wrinkling of the fingertip, the immersion was probably for 3 to 4 hours. If you see bleaching of the cuticle, the immersion was probably for 12 hours. If you see soddening, it was probably for 24 hours. And if you see cuticle starting to separate off from the palm, fingertips and sole, the immersion was probably for around 48 hours. Okay, then the internal autopsy finding. So in external autopsy finding, we saw signs of struggle, the external signs of struggle that indicate antemortem drowning. Those were froth and cadaveric spasm. And then we saw non-specific signs like goose flesh or goose skin and washerwoman hand / feet. Internal autopsy finding, obviously you are going to go ahead and examine the lung, the most important organ to be examined during drowning. Now let's say this person went through wet drowning, right? The water has entered inside the lung. The lung is going to be, number one, voluminous, because it is filled with water. Obviously it's going to be full of volume, and as it is filled with water, it's going to be heavy and boggy. Not only that, as it is filled with water, voluminous and large and distended, it is going to push against the ribs. So you will have indentation of ribs or the rib marks. Number 4, when you remove the sternum during dissection, the lung balloons out. It balloons out on its own. This is what you get, okay, in case of wet drowning. What is this? This is Poltov hemorrhage, which is seen in the lower lobe, in the anterior surface, just behind the pleura or subpleural. So these are subpleural hemorrhages, referred to as Poltov's hemorrhage. And Poltov's hemorrhage is as a result of struggle. And again, as soon as you get a sign of struggle, it indicates antemortem drowning. All right. Now, you need to be able to differentiate between antemortem drowning and post-mortem drowning just on the basis of lung findings, right? So, antemortem drowning can be of two types, either conscious antemortem drowning or unconscious antemortem drowning. If it is a case of conscious antemortem drowning, that means the person was conscious and alive at the time of drowning. Unconscious antemortem drowning means the person was alive but unconscious at the time of drowning. And post-mortem drowning means the person was already dead at the time of drowning. So if you look at the lung, in a conscious person, at the time of drowning, the person is gasping for air. So he inhales air and water. So you get emphysema aquosum. That is, there is air as well as water. Since there is air and water and there is struggle, there is churning and there is froth formation. In unconscious person, however, there is simply flooding of water inside the lung. The person is not gasping for air because the person is unconscious. So you get edema aquosum. There is simply flooding of water. Flooding of water. And since the person is not conscious, there is no struggle and there is no froth formation. In case of post-mortem drowning, you simply get hydrostatic lung. Chill. All right. Now, let's combine our knowledge from both external autopsy findings and internal autopsy findings and the various tests to differentiate antemortem drowning from post-mortem drowning. Starting off with the external autopsy findings or the external signs of struggle, that is froth formation and cadaveric spasm, is indicative of antemortem drowning. They are not present in post-mortem drowning. Number 2, trachea and bronchi, if they contain mud, silt, diatoms, algae, that means it is most probably antemortem drowning. In post-mortem drowning, they are not present. Talking about lung, the lung, number 1, shows Poltoff's hemorrhage. In antemortem drowning, because it's a sign of struggle. Post-mortem drowning, the hemorrhage is absent. In antemortem drowning, the lung is voluminous, heavy, boggy, distended. But in post-mortem drowning, the lung has collapsed. In antemortem drowning, you get, since there is struggle, air hunger, there is entry of air and water, you get emphysema aquosum. However, in post-mortem drowning, you get simply hydrostatic lung due to hydrostatic pressure. Stomach and intestine can contain mud, silt, algae in antemortem drowning, and they are absent in post-mortem drowning. Water in middle ear is present in antemortem drowning, but it is never present in post-mortem drowning. In middle ear, water is never present in post-mortem drowning. Diatoms and Getler test are positive for antemortem drowning, but they are negative for post-mortem drowning, which begs the question, what exactly is Diatom's test and Getler test? So let's learn about them. There are two very important tests that you need to know under the topic of drowning, and they are the Diatom test and the Getler test. Diatom test allows you to differentiate antemortem drowning from post-mortem drowning. That is, whether the death took place by drowning or was the person already dead and his dead body was dumped in water. That is, whether the person was alive at the time of drowning or not. Before understanding the test, you need to know what diatoms even are. They are nothing but unicellular algae, which are found in various sources of water. And these unicellular algae are of various types or various species. But what's common among all those types is that they are covered by a layer of silica. And this silica is important because it makes diatom resistant to acid, resistant to heat, and resistant to decomposition. This is a very important point and really significant for diatoms test, and I'll tell you exactly where this point holds significance. But before understanding the test itself, you need to know the mechanism or the relationship between drowning and diatoms. So here is the body of water, let's say a lake. And this is me beside the lake. I accidentally fall into this lake. So as I am drowning, what enters inside my lung are the water as well as the diatoms that are present in this water. So if it is a case of wet drowning, I repeat, if it is a case of wet drowning, then what enters inside my lung or what enters inside the alveoli of my lung are water as well as the diatoms present in that water body. Now these diatoms are really minute, around 40 to 100 micrometer in size. So they can easily cross the respiratory membrane and enter the capillary. Inside the capillary. Now, if I am alive at the time of death, right? And that is the situation. I am alive and then I dropped down accidentally in the lake and then now I'm fighting for my life, right? I'm alive at the time of drowning. If I'm alive, my body's circulation is intact. As a result, the diatoms that are inside my capillary gets distributed to the rest of the body by the pumping of the heart or due to circulation. It gets distributed to kidney, it gets distributed to liver, it gets distributed to spleen, and it gets distributed to bone marrow. Let's take a second scenario where I am already dead. That is, someone has killed me. Someone has killed me. And then this someone dumps my body into this lake. What will happen? As I am drowning, water will enter inside my alveoli, diatoms will enter inside my alveoli. The diatoms are really small, so they can cross the respiratory membrane and reach the capillary as well. But in second case, I am dead. So my circulation is no longer there. There is cessation of circulation due to death. As a result, the diatoms in the capillary does not get distributed to the rest of the body. So there is no diatoms in kidney, there's no diatoms in spleen, there's no diatoms in liver, and there's no diatom in bone marrow. So this is how you can differentiate ante-mortem drowning from post-mortem drowning. That is, if it is a case of ante-mortem drowning, I am alive at the time of drowning, then the diatoms get distributed to kidney, liver, spleen, and bone marrow. So if I take a sample of bone marrow, treat it with acid and heat and observe it under microscope, I'll be able to appreciate diatoms. On the other hand, if it is a case of post-mortem drowning, that is, someone has already killed me and then dumped my body in this lake. In that case, the diatoms in the capillary does not get circulated to kidney, spleen, liver, or bone marrow. In this case, if I take the sample of bone marrow, treat it with acid and heat, and then observe it under microscope, I won't be able to find any diatoms. So let's see how exactly the samples are treated and the test is carried out. First, we take a funnel. Inside this funnel, we put that sample tissue, which is usually your bone marrow. Let's say it is a case of ante-mortem drowning. So there are going to be diatoms inside this bone marrow due to the distribution of diatoms by the presence of circulation at the time when the person was alive. To this sample, I add nitric acid. And to the same sample, I also apply heat. Due to heat and nitric acid, the tissue dissolves. But the diatoms remain intact. Why? Because diatoms are resistant to acid and heat, as I said earlier. This is the significance of layer of silica around diatoms. Then I take the sample, put it in a centrifuging machine, and then take the sediment after I have put it in a centrifuging machine, and then observe this sediment under a microscope. Under a microscope, I will be able to appreciate the diatoms. But the test is not done. For us to truly determine whether it is a case of antemortem drowning or not, we also need to take the sample of water from that lake, from the very lake containing the diatoms. So we take the sample of this water and then observe it under microscope. Observe the diatoms and then compare the diatoms of the sample water with the diatoms of the sample tissue. If they match with one another, then this is a case of antemortem drowning and the drowning took place in this very lake. So that's your diatoms test. Again, what is diatoms test? Diatoms test is carried out with the help by keeping diatoms as the main source of test. Diatoms, they are unicellular algae found in various sources of water. They are of various species, but what's common among all those species is the presence of silica lining those diatoms, which is resistant to acid, heat and decomposition. If it is a case of antemortem drowning, then the diatoms that reaches the capillary gets distributed to various organs due to the presence of circulation when the person is still alive at the time of drowning. But if it is a case of post-mortem drowning, since the person is already dead at the time of drowning, there is no circulation and the diatoms in the capillary does not get distributed to rest of the organs. How to carry out the test? You take the sample tissue and treat it with acid and heat, and then observe it under a microscope after centrifugation. If diatoms is observed and these diatoms are the same as that in the water sample as well, that means the person died of drowning and where the drowning took place is the very same lake. Second is Getler's test. Getler's test is carried out in order to differentiate between saltwater drowning and freshwater drowning. In Getler's test, you actually take two samples. So you take one sample from the right side of the heart and the other sample from the left side of the heart. Normally, both right side of the heart and the left side of the heart have equal concentration of chloride ions. However, in case of freshwater drowning, as you know from your pathology of freshwater drowning and saltwater drowning, which I have already taught under the pathophysiology of drowning, freshwater drowning leads to hemodilution. Since dilution of the blood takes place, the concentration of chloride ion in the left side of the heart falls because the left side of the heart is in direct communication with the lungs, and it is at the capillaries where the concentration of chloride ion is falling down due to hemodilution due to freshwater drowning, and the concentration of chloride ion on the right side of the heart remains the same. So overall, the right side of the heart contains more chloride, higher concentration of chloride ion. In saltwater drowning, there is hemoconcentration. As a result, the concentration of chloride ion on the left side of the heart increases, and on the right heart side of the heart remains the same. So overall, on the left side of the heart, there is more concentration of chloride ion. See, the difference in chloride ion is significant only if the difference is greater than equal to 25 milligram per 100 ml of sample. Now, instead of using chloride ion, you can also use strontium, and the logic is exactly the same. And if you use strontium for evaluation, this is referred to as strontium test. And for strontium test, the difference in concentration of strontium is significant only when the difference is greater than equals to 75 microgram per liter of sample. And with that, you are done with Getler's test as well. And with that, we are done with drowning, and with that, we are done with the complete topic of asphyxia.